Hi, it's Dr. Amy, a pediatrician from Kinder. Welcome back to our special video series on COVID-19. So far we've talked about the spread of the virus, which has been very prevalent and fast through healthy-looking people. We've talked about who are the vulnerable populations and how containment can protect them by decreasing the overall number of people that suddenly need critical care. So now let's talk about social distancing, exactly what that is and how we can all help. Avoiding human interaction is the name of the game. This virus is spread by droplets, and droplets are between people, but also can stay in the air, as well as on hard surfaces for a period of time. Usually the droplets get onto our hands or on each other through sneezing, coughing, and then the hands touch everything, including ourselves, and that's how the virus lives on. So travel restrictions have sprung up all around the world. There is an optimal time for travel restrictions, especially when or to parts of the world that have not had this virus at all. But after the virus has reached community spread, which means we cannot trace exactly one-to-one who gave whom this virus, even smaller scale travel, just being outside your house, also comes into the equation, just because it creates opportunities for close human contact and also for viruses to travel with you from one local place to another. So subways, trains, any crowded, packed space would be a breeding ground for this virus to jump from people to people and also for our droplets to get on each other. So it looks like staying home in general is the most effective way to break that chain. And again, we've seen success here with South Korea, Taiwan, and China after they had the quarantine. But some of us must be outside the home because our jobs are vital to society. That's where maintaining the interpersonal space as much as we can, and then wearing protective gear when we have to be closer than that also come into play. The thought is that 6 feet would be difficult for the droplets to go beyond that, so 6 feet is good. And then whether or not we have close contact with other people, avoiding touching ourselves, washing our hands frequently, can also protect ourselves and our families. So washing hands have to be about 20 seconds at least with warm water and soap. So I'm sure you've heard you can sing happy birthday twice or row, row, row your boat twice. And again, this is very good when you're doing it with kids, which we'll talk about in the later video about how to talk about coronavirus with your kids. But also when you come home from the outside, changing your clothes, washing your hands before you interact with your family members. Now, shutting down schools has been a common practice. Not only is that a usual place of a lot of droplets being exchanged, but within a community, it's one of those places where members from different families routinely interact. And as you already know, that's where a lot of viruses get passed around. I know this is not easy, especially in the US, problems with childcare, school lunches. Some families depend on the infrastructure of school. But at the same time, if it contains this virus, it can save us a lot of other troubles down the road. That's why the widespread school closures have started, and I would expect them to continue for a couple weeks. So yes, you can still technically go outside. Definitely not to crowded places if you can avoid it. Try to be 6 feet away, wash your hands whenever you can. And if testing becomes available and we actually know who has it and who hasn't, you can also socially isolate with people who have the same status as you. So in our situation without reliable testing, I would think of yourself and your kids as presumably carrying the virus. Again, we're still in one of the earlier weeks in the US, so the people who will develop symptoms, a lot of us haven't yet. Or we might never, but we're carrying the virus right now, potentially. So as a precaution, I think we can behave as if we have it in order to help us protect each other and our family members. So before you go outside the house, ask yourself, if I am carrying the virus, how can I decrease the risk for other people and also for my family? So if you're young and healthy, again, social distancing might not be necessarily a matter of life and death for you, even though some young people will get very sick. But by and large, it's to protect the more vulnerable people in our community. And we can still influence this by this stage in the game. So your sacrifices and decisions with social distancing make a huge difference on your hospital and how many critically sick patients hit them at the same time, and ultimately can have a big impact on our society cost overall in mortality and bad outcomes. So our kids might also have some questions as their lives and routines get impacted. So next, let's talk about how to talk about COVID-19 with your children.